Hi, my name is Stacy Jupiter and I'm the Melanesia Regional Director with the Wildlife Conservation Society. And I wanted to talk a little bit today about an exciting new project that we have going in Fiji through WCS, as well as numerous different partners, the Fiji Ministry of Health, Edith Cowan University, University of Sydney, Fiji National University. That's called the Watershed Intervention for System Health in Fiji, or WISH Fiji. So I wanted to tell you a little bit about how this project came to be. It's been over a decade in the making. And it started out over 10 years ago when myself, my colleague Erin Jenkins, who was then running Wetlands International Oceania Program in Fiji, and a number of other collaborators through WWF, University of South Pacific, were implementing a large-scale ecosystem-based management project in Fiji. What we found in doing this, working with a number of different communities on Vanuatu Levu, in Matawara province and in Bua province, is that while a lot of the coastal communities were happy to implement various different management measures within locally managed marine areas, or LMMAs, people weren't necessarily changing their behavior about how they use the land. And there were a lot of poor decisions that were still being made about choosing to agree to lease lands for logging, to allow for gravel extraction, to allow for mining, to plant crops on high slope areas. And all of these different land-based activities, they cause a lot of sediments and nutrients and sometimes chemicals to get into the waterways, creating unhealthy waterways for the food resources that people need for their food, the fish and invertebrates, but also for income and cultural practice. And we started thinking about, well, what would create incentives for people to change their behavior on land? And for me, in 2009 was the first big light bulb moment. I was flying back from a Hawaii holiday and I landed, the plane was coming through the clouds, landing in Nandi. And I looked down and I saw water up to the roofs of all of the houses on the Nandi floodplains. I thought, wow, this is catastrophic. And it was a catastrophic flood event. There were over 8,000 people displaced from their homes in Fiji. There was over $300 million worth of damage to infrastructures. But a really pernicious issue that was associated with floods that we didn't see until much later was that several months after this flood event in 2009, again, floods that happened in 2012, 2011, after these heavy rainfall events or tropical cyclone events, we started seeing peaks in waterborne bacterial disease like typhoid and leptospirosis. And so Erin, myself, and other colleagues thought, wow, well, if people thought that there would be a reduced risk, you'd be less likely to get these diseases like typhoid and leptospirosis, it's likely that people would take action within their watershed and start taking seriously the need to think about whole of system watershed management for the health of their waterways, for the health of themselves and for their children, as well as for the health of the downstream freshwater and marine communities. We tried to seek funding in order to carry out the experiments to get the evidence for this. This was starting back in 2010, 2011. There wasn't any funding on the table. Erin went back and did his PhD looking to see if there were any environmental factors in Fiji that could be associated with incidence and occurrence of typhoid. And he found that, in fact, there are. In areas where there's been a lot of clearing of forests, particularly around rivers, the riparian areas, in areas where there's a lot of clearing along high slope areas with highly erodible soil, and in areas where there are high density of roads, particularly unsealed roads that cross the creeks. These were all areas that were identified at the subcatchment level where there were higher incidences and occurrence of typhoid. And so now we've put together a coupled project to see if we can work with local people to do interventions within the watersheds to be able to improve river system health as well as the health of people and downstream ecosystems like coral reef. And so that is what encompasses WISH Fiji. It's a huge undertaking. Right now, our teams are out in the field collecting baseline data, and this will form the information from which we'll go back to the communities and help co-design appropriate management interventions. And then we'll see what happens. We hope that this will reduce disease incidence, and we hope that this will improve ecosystem condition in freshwater and downstream coral reefs in Fiji.